Hi, my name is Diana Sandoval. This is my head to toe assessment for the fall 2025 with Dr. Buford. Today's October 26, 2025. This is my patient Esteban. I have introduced myself to the patient and performed hand hygiene prior to beginning the recording. This is the scanning of the room. And the ceiling and my equipment and the floor. Okay. We will begin with the assessment of the skin. I'm assessing the face and neck, the anterior chest, posterior chest, and abdomen. I'm assessing for skin integrity such as skin texture, color, moisture, temperature, any bruising, scarring, lesions, signs of nevi, skin turgor, and edema, and there's none noted. Everything is normal. Now I'm going to continue inspecting the head and palpating the head as well. The head is normal cephalic size, midline position, and symmetrical bilaterally. I don't see any signs of masses, indentations, depressions, signs of infestation, or tenderness to palpation. Hair is distributed evenly. It is a natural brown color and it is coarse. I'm going to go ahead and palpate the lymph nodes. It's preauricular. Go ahead and turn your face. Postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. No tenderness, no enlargements noted. I'm gonna fill for the temporal arteries. There are 2+ symmetrically on both sides. And then I'm gonna go ahead and also palpate the temporomandibular joint for any subluxation, crepitus, or tenderness. Go ahead and open your jaw and close it. And there's none noted. I'm gonna assess cranial nerve number 5, trigeminal, motor and sensory function. We'll begin with the motor function. Go ahead and clench your jaw. I'm palpating over the masseter muscle. It's non-tender. And open your mouth. Yep, and it's functioning just fine. I'm gonna assess sensory now. Go ahead and close your eyes. Tell me where I'm touching you.
Forehead, nose, left cheek, right cheek, chin.
Okay, cranial nerve number 5 is intact. I'm gonna go ahead and assess cranial nerve number 7, facial. I'm gonna look for symmetry with the facial expressions that I'll ask you to do. Go ahead and smile for me. Frown, pucker your cheeks, or puff out your cheeks, pucker your lips and raise your eyebrows. Cranial nerve number 7, facial is intact. I'm gonna go ahead and inspect the ears. I'm looking for symmetry, position, size, and shape, and it is all normal, and it is symmetrical bilaterally. I'm gonna inspect the auditory canal and the tympanic membrane, and it's clear, and tympanic membrane is a pearly gray, and I'm pulling up and back, and I'll do the same with the other side. Okay, and auditory canal is clear, and tympanic membrane is a pearly gray, which is normal. I'm gonna assess cranial nerve number 8, vestibulocochlear. I'm gonna perform 3 hearing tests, and then that's how I test it. Oh, and I'm also gonna palpate the pinna and the tragus for any tenderness or masses. None are noted. And now I'm going to assess cranial nerve number 8, vestibulocochlear. I'll begin with the whisper test. I'm standing about 2 feet behind of the patient. When I say 3 words, let me know what I say.
1, 2, 3.
I'll do the same on the other side.
Green, purple, pink.
That is intact. Now I'm going to do the Weber test. I'm going to put this in the middle of your head. Let me know if you hear it in the same way.
Yes.
Both sides.
Yes.
No lateralization noted. I'm going to do the Rene test. I'm going to check for air conduction over bone conduction. Again, I'm going to activate my tuning fork. I'm going to put it in the back of your ear. Let me know when you stop hearing it, and you'll let me know which one's louder.
Yes.
I'll go on the back of the ear and the mastered one.
Now. Now.
Which one's louder?
2.
We'll do the same on the other side.
Now. Now.
Which one's louder?
2.
Okay, Rene test is normal air conduction, greater than bone conduction. Cranial nerve number 8 is intact. I'm gonna go ahead and move on to the eyes. I'm inspecting the eyebrows, the eyelashes, the palpebral fissures. There's no concerns there. I'm also gonna inspect the conjunctiva and the sclera. There's no discharge, lesions, or tenderness, or any concerns there. I'm gonna go ahead and assess the optic nerve, which is cranial nerve number 2. We'll begin with peripheral vision. I'm gonna have you cover one of your eyes, and then let me know, and don't move your head, just look at my nose, and then tell me what you see.
1, 2, 3, 2.
Okay, peripheral vision is intact on the left eye. Cover the other eye, and then we'll do.
1, 2, 3, 4.
Okay, peripheral vision is intact. Now we're going to do the Snellen chart. I'm going to have you do it with both of your eyes first. Can you read the last line?
LTFPH.
Okay, 20/20 vision with both eyes, and then cover one of your eyes.
LTFPH.
Left eye 20/20 vision, and then cover the other eye.
LTFPH.
Okay, 20/20 vision as well on the right eye. So cranial nerve number 2 is intact. I'm gonna go ahead and check oculomotor cranial nerve number 3. I'm gonna check for pupillary iris response to light and consensual, so that both of them are reactive to the light at the same time. Okay, pupils are equal round and reactive to light. And then I'm gonna check for accommodation and convergence. Stare at my pen light, and then don't move your head, just follow it. Okay, accommodation and convergence is present, so cranial nerve number 3 is intact. Now I'm gonna assess cranial nerve number 3, 4, and 6, oculomotor, trochlear, and abducens. I'm gonna check the muscles of the eye in the 6 fields of gaze. So you're gonna follow my pen light with your eyes only, don't move your head. Okay, cranial nerves 3, 4, and 6 are intact. I'm gonna assess for the red reflex, and also for the internal eye structures. There's my ophthalmoscope. Okay. Okay, red eye reflex is present and internal eye structures are intact. Do the same on this side. Okay, red eye reflex is present and internal eye structures are also intact. I'm gonna move on to the nose. The nose is midline position and straight. I'm gonna check olfactory nerve, cranial nerve number 1, and nasal patency at the same time. So I'll have you close your eyes and cover one of your nostrils. Go ahead and take a deep breath in and tell me what you smell.
Alcohol.
Okay, and then we'll do the same on the other side.
Alcohol.
Okay, cranial nerve number 1, olfactory, and nasal patency is intact. I'm gonna go ahead and palpate the carotid arteries. Sorry, the temporal arteries. They're 2+ bilaterally. I'm gonna go ahead and look in the mouth. I'm inspecting and assessing the lips, the teeth, the buccal mucosa, the gums, the palate, under the tongue, the posterior pharynx, and the tonsils. So everything's intact. Tonsils are 1+. Salivary glands are intact and all teeth are present. No concerns with that. I'm gonna assess cranial nerves number 9 and 10. Glossopharyngeal and vagus. We're gonna look at the rising of the uvula and the soft palate with phonation. So I'll go ahead and say ah. Okay, rise is symmetrical. Cranial nerve number 9 and 10 are intact. Now we're gonna check hypoglossal. We're gonna look for any fasciculation with the tongue. So I'll have you stick your tongue out. Tongue is midline position. I'll have you move it up, down, and then side to side. Cranial nerve number 12 is intact. I'm gonna assess the neck. And the neck is midline position. I'm looking at the trachea. It also seems to be a midline position, but I'm gonna go ahead and palpate. It is midline position. I'm gonna deviate the trachea to the side and palpate for the thyroid. Go ahead and swallow. No nodules or tenderness. We'll do the same on the other side. And no nodules or tenderness there. And the thyroid gland is non-palpable. I'm gonna assess the carotid arteries, and they're equal bilaterally, 2+. I'm gonna listen for any bruits. Go ahead, take a deep breath in and hold it. Okay, no bruits heard bilaterally, that is normal. We're gonna continue assessing the chest. I'm looking at the posterior part of the chest. I'm looking for any deformities or misalignments. I'm also looking for any signs of respiratory distress, such as tachypnea, accessory muscle use, retractions, tripod positioning, cyanosis, nasal flaring, and there is none noted. So I'll go ahead and palpate for chest symmetry. Go ahead and take a deep breath in. Okay, chest is symmetrical. And then I'm gonna go ahead and percuss over the lungs. And then I'm doing it in the intercostal spaces. Okay, percussion is normal. I'm gonna go ahead and auscultate the lungs with the diaphragm. Take a deep breath in when I touch you. Good. Again, 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 and last one. Good, everything is normal. Lung sounds are clear. Now I'm going to go ahead and listen for egophony. Every time I touch you, say E.
E, 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 E.
Okay, egophony is normal. I'm going to go ahead and auscultate for bronchophony. Every time I touch you, say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, bronchophony is normal. Now I'm going to assess for whisper picturoloquy. I'm going to have you say 1, 2, 3 in a whispering voice.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay, whisper picturoloquy is normal. We're going to go ahead and have you turn back. We're going to assess the chest again for symmetry or any chest deformities or misalignments. I'm going to touch for chest expansion. Go ahead and take a deep breath in. And it is symmetrical bilaterally. I'm going to feel for tactile fremitus. Go ahead and say 99.
99, 99.
Okay, and that was normal. And I'm going to listen to the lung sounds on the anterior chest. Go ahead and take a deep breath in. Good. Okay, lung sounds are clear. Now I'm going to listen to the heart sounds. We'll begin with the right sternal border, second intercostal space, aortic, left sternal border, second intercostal space, pulmonic, left sternal border, third intercostal space, Earth's point, fourth intercostal space, sternal border, tricuspid, and then fifth intercostal space, midclavicular line, mitral, and I will listen for the apical pulse for a full minute to give you a rate in the sinus rhythm. Rate is 73, and it's sinus rhythm, no extra heart sounds such as murmurs, gallops, clicking or ticking sounds. And I'm gonna palpate for the PMI, and that is normal as well. Then go ahead and listen with the bell of my stethoscope. Aortic, pulmonic, Earth's point, tricuspid, mitral, and that is normal. I'm gonna go ahead and have you, lay down now. And we're gonna put you at a 30 to 45 degree angle to check for JVD, which is jugular vein distension. Go ahead and, yes, stretch out your neck. I'm looking at the side for any distension or pulsations, none is noted. And I'm also doing the other side, no pulsations, no distensions noted. So I'll have you get rid of this. And then I'm gonna inspect for any lifts or heaves in the chest area, and there's none noted. And then I'm also gonna go ahead and palpate the auscultation points for any thrills or any abnormal things. And we'll do aortic, pulmonic, Erskine, tricuspid, mitral. There's no thrills felt. So now I'm gonna go ahead and auscultate. We'll begin with the diaphragm, aortic, pulmonic, Erskine, tricuspid, mitral, sinus rhythm, S1 and S2 are heard. And I'm going to listen to the aorta for any bruits, the right renal artery, the left renal artery, the left iliac artery, the right iliac artery, the right femoral artery, and the left femoral artery. And there's no bruits noted during auscultation. I'm going to go ahead and also listen to bowel sounds in all 4 quadrants. Okay, bowel sounds are active and present, and the abdomen is round and symmetrical on both sides. I'm going to go ahead and percuss in all the quadrants. I'm percussing for tympany, dullness, and flatness. And I percuss over the liver and the spleen. And I'm going to go ahead and palpate all 4 quadrants for any tenderness or masses. I'll palpate for the liver as well. And I'll palpate for the spleen. And there's no tenderness, masses, or any concerns with the bowel. So I'll have you sit up. And I'll have you sit sideways really quick so they can see your back. Okay, I'm going to check for CVA tenderness. Let me know if you have any tenderness.
No.
Okay, go ahead and turn back. Now we'll assess range of motion. We'll begin with the upper extremities. Assessing radial pulses. Any edema, there's none. And then capillary reflex is less than 3 seconds bilaterally. I'm going to go ahead and palpate for any crepitus, tenderness, nodules, masses, and there's none. Okay, we'll do range of motion of the fingers. We'll begin flexion, extension, hyperextension, abduction, adduction, finger or thumb opposition, excuse me. Just these 2. Okay, full range of motion of the fingers. And then we'll do wrist, flexion, extension, hyperextension, rotation. Full range of motion bilaterally of the wrist. And then we're going to do elbows, flexion, extension, hyperextension. Full range of motion bilaterally of the elbows. And we're going to assess the shoulders now. We'll go flexion, extension, hyperextension, abduction, adduction, internal and external rotation. Internal and external rotation. Good full range of motion of the shoulders. Oh, and circumduction as well. And full range of motion of both shoulders. Now we're going to go ahead and assess for strength. So I'm going to have you put up your elbows a little more high. Now let me push, now let me pull. 5 out of 5 strength bilaterally of the triceps and the biceps. And then we're going to do shoulders. So go ahead and put your shoulders out. And then don't let me push you down. Don't let me pull you up. 5 out of 5 strength bilaterally of the shoulders. You can put your hands down. And now we're going to assess cranial nerve number 11, accessory. I'm going to have you shrug your shoulders against my force. Okay, cranial nerve number 11 is intact. Now we're going to check for deep tendon reflexes. So we're go brachioradialis, and then the bicep and tricep. Okay, and then we'll do the other side. Okay, and the bicep, and then the tricep. Okay, good. And we'll do the same on the bottom. So we'll do the patellas. Okay, good. And then the other side. Okay, and then we're gonna do the Achilles. And then the other side. And the Babinski reflex. Okay, the other side. Okay, that is normal. And now we're gonna assess for sensation. So go ahead and close your eyes. Let me know where I'm touching you.
Arm right now. Left arm. Left shin. Right shin.
Okay. Light sensation is present. Now I'm gonna do vibratory sensation. I'm gonna put it on the proximal ulna. And let me know if you feel this.
Yes.
And then we'll do the other side.
Yes.
And then medial malleolus,
Yes.
bilaterally.
Yes.
Okay, vibratory sensation is present, no concerns. And again, there's no signs of edema or anything like that, okay? So now we'll assess the cerebellar coordination. So we'll begin with finger, the finger opposition. So we'll go like this and then back. And then we're gonna do finger to finger. So you'll touch your nose and then touch my finger. Okay, and that is normal. And now I'm gonna have you close your eyes. I'm gonna put an item in your hand and let me know what it is.
Fork on right hand. Pen or flashlight on the left hand.
Okay, good. Sternognosis is intact, or excuse me, graphesthesia is intact. No, sternognosis is intact, and I'm gonna do graphesthesia. So put your palms out and then close your eyes. Let me know what I draw.
T. M. S. X.
Okay, graphesthesia is normal. Now we're gonna go ahead and assess grip strength. Go ahead and squeeze my fingers, 5 out of 5 strength, and I'll have you stand up. Oh, sorry, sit down. I'm just gonna check for the range of motion of the toes as well, and then we'll do the ankles. So we'll begin, same thing, extension, flexion, hyperextension, abduction, adduction. Full range of motion on bilateral toes, and then we'll do ankles, dorsiflexion, plantar flexion, rotation, and full range of motion of the ankles. And then we're going to assess for strength. So go ahead and push down against my hand and pull towards your nose. And then we're going to do strength of the knees. Don't let me push you, don't let me pull you. And now we're going to do strength of the hips, and that is 5 out of 5 strength of the ankles and the knees. And now we're going to do hips. Now push against me, pull towards me. 5 out of 5 strength on the hips bilaterally. Go ahead and stand up. Now we're going to do range of motion of the knees and the hips. So I'll have you begin with the knee, flexion, extension, hyperextension. We'll do the other side, flexion, extension, hyperextension, and then we'll do hips, flexion, extension, hyperextension, abduction, adduction, internal rotation, external rotation, and circumduction. Good. Then we'll do the other side. We'll begin with the knee, flexion, extension, hyperextension, full range of motion on the knees. And now we're going to do the hip. And now we'll do flexion, extension, hyperextension, abduction, adduction, internal rotation, external rotation, circumduction. Full range of motion of the bilateral hips, bilateral knees. And then now we're going to do the Romberg test. So I'll have you close your eyes and put your hands out. There's no swaying or losing balance. Romberg test is negative. That is normal. Go ahead and put your arms down. And then go ahead and assess your back. I'm looking for any signs of tenderness. There's none. Misalignments or any abnormal curvatures. There's none. So I'll have you down a little more, a little more. Okay, I'm looking for any signs of scoliosis. The scapulars are at the same level, so there's none. Go ahead and stand up. We're gonna do now extension of the lumbar, and then you already did flexion, but we'll just do flexion, lateral flexion, and then rotation. Lumbar range of motion is intact. We're gonna do cervical spine, so flexion, extension, hyperextension, lateral flexion, and rotation. Cervical range of motion is intact. Now we're gonna go ahead and have you walk away from me and walk back heel to toe. Okay, regular gait in tandem. Good. And then we'll have you hop on one foot and then hop on the other foot. Okay, and that concludes my head to toe assessment.